Good afternoon, everyone. Thanks for joining us again this Friday. I just want to start by acknowledging the fact that I'm getting a bit of a reputation for delivering bad news, and I'm sorry. I try and be a realist about what we're experiencing and what to expect in order to give people the best information as possible to make good decisions about keeping themselves healthy and our communities healthy. That said, I want to start with a bit of good news this week. Compared with 1 month ago, we now have an hour and 20 minutes more daylight in the Seattle area, in the greater Puget Sound area. And I think that's something that we're all grateful for and look forward to more sunlight over the next 3 to 6 months. And as much as I'd like that sunlight to continue to increase on ad infinitum, I know that at some point our days will get shorter again. Now I'm going to start with our EPI update and talk a little about vaccine and new variant, and then welcome your questions. Since our outbreak was recognized, we've experienced almost 80,000 cases in King County, almost 5,000 hospitalizations, and over 1,300 deaths. We've had 39 more deaths this week since we spoke a week ago. At the same time, we can't ignore that the level of COVID-19 transmission and risk here continues to represent a serious health threat, even though our numbers are dropping. So, for example, our 7-day average of new cases is about 200 cases a day. Our 14-day incidence is about 156 per 100,000, which is still considered high risk. We saw 15 hospitalizations per day in the past week, and about 3 people died from COVID-19 every day last week. And it's important again to recognize the disparities in COVID-19 impact that persist even as our rates are falling. Case rates in South King County communities such as Auburn, Kenton, Federal Way, Burien, Renton, Tukwila, and SeaTac, they're approximately 3 times the rate in Central Seattle, and the hospitalization and death rates are 3 to 4 times higher in these areas. So again, I'm very glad to be able to report that our new cases continue to fall. But because we started our fall from such a high altitude, even though we're still falling at the moment, we remain at a high level of COVID-19 transmission. And I want to thank you to everyone for continuing to take the hard steps that have been needed to limit the spread. Keep up the good work. I hope this fall continues, as it must, if we're going to be successful over the next few months. Because at the same time, we cannot become complacent because we are not close to a we got this moment. And last week, I likened our situation to being in the eye of a COVID hurricane. And even though things seem relatively calm at the moment, we should expect and be prepared for a serious storm on the horizon. And the reason for this is that the more contagious and possibly more severe B.1.1.7 variant strain is here, as it is across most of the US. And it is silently doubling about every 10 days and is expected to become widespread in the next month or so as exponential growth accelerates. And I encourage folks who aren't familiar with exponential growth to Google it and look at it. What it means is that the larger an outbreak gets, the quicker it accelerates. And so when the numbers are small, we don't really notice the doubling much. But as soon as we hit a certain threshold of a large number, that doubling becomes very apparent. So we're going to need to work harder and be better at COVID prevention against this virus variant to avoid a very large and destructive 4th wave. I think we may be watching the tide silently recede before a tsunami. We need to continue to do everything we can to prevent the spread of COVID-19 in all aspects of our lives and get our numbers and hospitalizations as low as possible before the variant reaches this critical mass and erupts. Now, there was new guidance from our department and CDC this week on the effectiveness and importance of wearing face masks that are well made and fit well to significantly reduce the risk of COVID-19 to both the wearer and others. So again, we are all safer when each of us wears a mask when around people outside of our households. And this means Wearing a mask that's made of multiple layers and snug fitting around the face without air leaks. The breath should go through the layers, not around the sides or out the top. That said, we also need to keep in mind that no single strategy is enough to protect against COVID-19. Wearing a face mask whenever around people who don't live in the home is one of the most effective strategies, but must be combined with limiting our activities, avoiding crowded indoor spaces, improving indoor ventilation, continuing to wash hands. Ultimately, getting enough of us vaccinated will be our most powerful weapon against COVID-19 over the long term. Now, I also just want to take a minute, as I did last week, to remind people how important testing is to limit the spread of infection to others. Many infections, 30 to 50% spread from people who don't know they're infected, they don't look or appear ill, they're not intending to spread, but when we're around our family members, our coworkers, our friends, we can't tell who may be exhaling virus particles into the air that we're breathing in. So we need to take precautions, and we need to remind anyone who's been around someone who's had COVID, or anyone who has symptoms of COVID or is ill, please isolate away from others and get tested. And you can do that through your provider or one of our free testing sites in King County. Now, I want to pivot to vaccines, which is a topic of great interest for good reason. Our vaccine supply remains a major challenge both at the national, state, and local levels. We are continuing to vaccinate those most at risk as quickly as our supplies allow. Washington State received 206,125 doses this week, which was an increase of nearly 50,000 doses from last week. And this week, providers in King County received over 78,000 doses. That's nearly double last week's total. And although the numbers are going up, which is excellent, we are in a situation now where many people are coming due for their second doses, and the majority of doses received this week were second doses, meaning we're having fewer people able to get that first dose while we catch up on those needing the second dose. So in other words, a greater proportion of the vaccines that we're receiving are being used to deliver that second dose currently. All in all, over 340,000 doses have been administered to King County residents, which is up 30,000 doses from last week. Over 260,000 people have received at least one dose in King County, and over 81,000 are fully vaccinated. We're continuing to make good progress in reaching our healthcare workers who've been on the front lines of our outbreak. Approximately 2/3 of licensed healthcare workers have received at least one dose. We are seeing some disparities, though, in the proportions of nurses and physicians compared to medical assistants and technicians. And we have a higher proportion of nurses and physicians assistants and physicians who have been vaccinated, while a relatively lower proportion of medical assistants and technicians. And these job classifications represent a larger proportion of people of color. So I really want to encourage everyone who works in a healthcare setting to please consider coming forward for vaccination. It protects both you and those around you. With respect to our older adults who are at highest risk of hospitalization and death, we're making substantial progress. These are our most vulnerable community members. And currently, 46% of our King County residents who are 75 and older have received at least one dose. That's up from 40% last week. And 41% of our residents who are between 65 and 74 years of age have received one dose. And that's up from 34% last week. With respect to our long-term care facilities, another of the highest risk settings, all of our 51 skilled nursing facilities have been visited by at least once by a vaccinator. 153 of our 154 assisted living facilities have received first dose visits, and about 2/3 of our adult family homes have either received the first dose visit or are enrolled in the federal pharmacy program. And we are continuing to see disparities both in who is being affected by COVID-19 and getting sick, hospitalized, and dying, and those who are getting vaccinated. So, for example, compared with people who identify as white, people who identify as Black are 3 times more likely to be hospitalized and over 50% more likely to die. And those who identify as Hispanic are 6 times more likely to be hospitalized and 3 times more likely to die. Yet, these groups are underrepresented among those who have been vaccinated, and we're working hard to address that. So, for example, among those who are 65 and older who identify as white, 39% have been vaccinated. But among those who identify as Asians, 31% have been vaccinated. Among those who identify as Hispanic, 25% have been vaccinated. And among those who identify as Black, 20% have been vaccinated. So we need to really continue to do better, given that people of color have been disproportionately hard hit by COVID-19 in getting access and uptake of vaccine in those communities. Similarly, if we look by geography, we can see that we have very high rates of vaccine coverage in certain areas. For example, our highest rate of coverage among the 65 and older group is on Vashon Island, where almost 60% of their 65 and older population have been vaccinated, whereas the similar figure for North or Central Seattle is 45%, and only 34 to 36% of those in South King County and South Seattle have been vaccinated. Now, this disparity between vaccination coverage rates in South King County compared to North and Central has improved since last week, thanks in part to our opening of our large throughput sites in Kent and Auburn, but we clearly need to do more to close those gaps. And I'll tell you a little bit about what we're doing to close those gaps now. We're doing new outreach to high-risk and hard-hit communities. So we have a new Redmond vaccine partnership. And this week we worked with partners at Microsoft to launch a new vaccine site in Redmond for high-risk eligible older adults and their caretakers. And we've partnered with a number of community organizations reaching out to eligible older adults hardest hit by this pandemic, including those in the Black, Hispanic, Latinx, Asian American, Native Hawaiian, Pacific Islander, and Ukrainian Russian communities. Appointments are not available at that site to the general public at this time. And we've partnered with organizations such as the Asian Counseling and Referral Service, Lifelong AIDS Alliance, Chinese Information Services Center, and Neighborhood House on this project. And the first week, the site will serve 400 people per day, and we hope the volume will increase as vaccine supply increases. In order to do this work, both at this Redmond site and with other partners in the community, we've created a set of vaccine equity principles, which we expect all of our partners to agree to abide to in order to be part of this work. And these principles are a focus on people at highest risk and communities most impacted, working with community to help connect those most at risk with the services, making registration easy, making vaccine available when and where people are available, for example, evening and weekend appointments, addressing transportation and mobility challenges, particularly for older adults and people with disabilities, and ensuring language access for people who don't speak English as a first language. Our Kent and Auburn sites have been operating since February the 1st, serving about 1,000 King County residents a day at the 2 sites. And we are supporting those efforts by engaging with 20 community partner organizations serving older adults and working with our community navigators to help older adults contact and schedule appointments for elders. And we've had good success reaching the high-risk community of people vaccinated at these sites. 38% are 75 and older. Others are over 50 who can't live independently or are their home caretakers. We have about 31% of the vaccinees at these sites who self-identify as Asian, 5% as Hispanic Latinx, 5% as Black or African American, about 1% American Indian or Alaskan Native, and then lower numbers mixed race, and about 0.5% Hawaiian Pacific Islanders. So we clearly want to continue to reach communities who are disproportionately impacted and offer equitable access to vaccine to all, but again, focusing on those who've suffered the highest rates of hospitalization and death. And as more vaccine becomes available, we're looking forward to expanding these efforts. Now, in addition to these sites, we have 9 mobile teams in the field currently vaccinating high-risk populations across the county. 4 new mobile teams initiated activities this week, and we're hoping to meet and eventually exceed our goal of 10 mobile vaccine teams in the field very soon. And these efforts include the Seattle Fire Department's mobile vaccination teams who are vaccinating eligible older adults in affordable housing buildings. And we'll be hosting a pop-up vaccination clinic for African American elders in partnership with the Central Area Senior Center. Much of our efforts are focused on getting home healthcare workers and staff in long-term care facilities vaccinated as well, as they are at high risk and are comprised of a large proportion of groups who've been most highly impacted, including Pacific Islanders, Latinx, and Black healthcare workers. And we're working hard to reach people who have difficulty using our online reservation systems. So for example, the Area Agency on Aging contacted over 3,000 seniors and assisted in scheduling over 1,000 appointments for community members, many of whom have limited English language proficiency. We're also continuing the work with our trusted community leaders and community navigators who represent 22 language and ethnic groups who've helped those eligible sign up for appointments. And we're partnering with community-based organizations serving Black and Indigenous peoples of color, older adults in particular, such as the Hmong Association of Washington and the Helping Link, which serves the Vietnamese community. So I think with that, to respect everyone's time, I am going to stop and welcome your questions.
Great, thanks, Dr. Duchin. For media, if you have a question, please use the raise your hand function in Zoom. And when we call on you, please state your name and which outlet you're with. So first question is from Jessamine McIntyre.
Hello, Dr. Duchin. I am sorry that you started this by saying you're always delivering bad news. We at Q13 have found you informative and giving us important news. So don't feel like it's always bad. We do appreciate it. My question though has to do with considering the weather that we have been experiencing and anticipating throughout the weekend. What will happen with the sites that are vaccinating and what do you anticipate to happen throughout the weekend?
Yeah, we have, well, first of all, we want to make sure that everyone stays safe. And so regardless of where you're seeking vaccination, please use good judgment and don't put yourself in an unsafe position to get to your vaccine appointment. We certainly will allow people to reschedule if they can't get to their appointments, and we hope our community partners will. We expect them to do that as well. We are going to move our Auburn site into the Kent Showware Center, so all those vaccination appointments are moved to an indoor location. But again, anyone who has trouble reaching that location or any other site because of the weather or feels that it's unsafe should just reschedule.
Great. Next question is from Allison Grande.
Dr. Duchin, 2 questions. I believe I saw it was public health that mentioned on social media about not wearing a wet mask. Can you tell us how a wet mask doesn't work? And also, we're hearing the federal government's getting hundreds of millions of more doses. When might we see some for the next tiers as we move on?
Yeah, thanks. The issue with masks is that, well, they become very uncomfortable when they're wet. So that's one issue. And people tend to manipulate them a lot, because they're feeling uncomfortable. The key factors in how well a mask protects you and protects others are the barrier that the mask provides to someone who is not necessarily even knowing they're infected, but is breathing out virus particles to stop those particles from entering the airspace that others will breathe in. And then also the mask provides some protection by filtering incoming air. And some of those particles that are suspended in the air get stuck in the mask instead of going down into the body. So they're, depending on what your mask is made from and how many layers it has and how snugly it fits, that determines how well it protects both others in the environment and protects ourselves who wear the masks. And it's hard to generalize because there's so many different materials, but in general, multiple layers, 2 to 3 layers that are very snugly fitting are optimal. And once a mask gets wet, the air may not be able to go through it as easily, may be forced around it, and people may be pulling on it and tugging it and letting the the seal break that's keeping the sides snugly fit on the face. So I encourage folks to take a look at the new guidance on our Public Health Insider blog, and also the CDC has excellent new information about how to select a good mask, how to have a mask fit well, and there are some really innovative methods now. There are devices, mask fitters that will snug up a mask on the face. And then others have suggested that double masking may be an option. And whatever works for you to get that mask snug down, is great. But it does need to cover the mouth and nose and seal around the sides so that the breath goes through it and doesn't get forced around it.
And I think the second question was about large volume of vaccines coming to the federal government and when we might see some of that impact here.
Yeah, so the good news was that the federal government did purchase additional millions of doses. These doses are not going to be delivered in the short term, but there will be available in the spring at some point, and the estimates are now that there'll be enough to vaccinate everyone who's eligible and interested before the end of the summer, which is very good. We haven't received any specific information about how our allocations will change, but in general, we're expecting the numbers to increase gradually over time. And I think for the next week or so, most of the number of doses that we're getting, even the increasing number, will be going to those people who've had the first dose to ensure they get the complete series. And then we'll be able to expand more rapidly additional vaccine access to people who have not yet been vaccinated. That is still going on currently. There are still people who can get first doses, but relatively fewer given the fixed supply of vaccine that we're currently experiencing.
Next question is from Evan Bush.
Dr. Duchin, thanks for your time. Your department is clearly focused on equity, and has long been planning for to reach the population that's been disproportionately affected by COVID-19. But I noticed the week of February 4th, the Department of Health allocated just 19% of vaccine to local health jurisdictions, community health centers, federally qualified health centers, and private practice. I mean, are you all receiving a large enough proportion to make it impact on equity locally?
Not large enough. I think that's a fair statement. We would like more vaccine for all of our groups. I mean, the way we look at our allocation, regardless of the size, is we try and focus it on where the need is greatest based on where the impact of COVID-19 has been greatest, so highest, both rates of hospitalization and death. So that could be right now, it's the age groups, the older ages, and then the communities that have suffered disproportionately. And the more vaccine we have, the more we can address the needs. Now, right now, we have disparities because given the supplies we've had and the fact that a large number of those doses came in phase 1A, which was largely the Pfizer vaccine, which was largely distributed through our hospitals to healthcare providers and through the federal pharmacy and other pharmacy vaccinators that could store that ultra cold device and administer it in long-term care facilities. That inherently created some disparities because that population of eligible are predominantly white, or relatively higher proportion of white, compared to the general population, for example, of people just over 65 or 75. So as the phase 1B started and we started to get more of the Moderna product, we are trying to allocate that product to those communities and those individuals at highest risk. And many of them are served by our community health centers. We would like to see more allocation to that sector, as well as more allocations to our other healthcare providers who are wanting vaccine and can't get it, our hospitals and so on. But we need to try and use that limited supply to address these disparities to the greatest extent possible. And we know that our community health center partners are key in doing that because of the populations that they serve. So we're very eager to have more allocations available for that sector.
Thank you. Next question is from Pablo Gaviria.
Thank you so much. My question is about the Redmond site. To get a call from your community partners, would they need to already have had contact in the past with one of these organizations, or how do they know to contact someone? And also, what organizations are reaching out to eligible Spanish-speaking residents?
Well, thanks for your question, Pablo. I'm not sure I can answer it completely, so we may need to follow up with you a little bit. The outreach is going, the organizations are reaching out to their community members and their stakeholders. I don't know that it's going the other direction, that we've asked the community to reach out to these organizations directly. Of course, I think that would be fine, but I don't think that is, as far as I know, the way the process is working. It's more the other direction, where the organizations have offered to assist us in identifying high-risk, vulnerable adults in their communities, and they are doing the outreach in that direction. But we can find out for you specifically which organizations are addressing which languages and how that's being done. Again, I'll ask our team to connect with you after this conference with that information.
Thank you for that.
Thank you. Next question is from Sandy Doughton.
Hi, Jeff. Thanks for doing this. My question is kind of a longer term one. We've been, for a long time targeting what's called herd immunity, but now we have these variants. So I'm wondering, how do these new variants affect our ability to reach that goal? And is herd immunity still a realistic target, or should we be thinking about it differently?
Mm-hmm. Yeah, thanks, Sandy. Yeah, I think we probably want to think about it a little bit differently. Clearly, the vaccines are incredibly potent weapon against COVID-19. They're very effective, highly effective against the current strain, against the B.1.1.7 variant, and they appear to be effective against severe disease by some of the other variants that are less common. South Africa, so-called South Africa variant, and variant from Brazil. The question, though, of whether we can ever reach herd immunity is I think an important one. And I don't think that should be our goal necessarily. With our vaccination program, I think what we want to do is acknowledge that vaccines prevent serious illness and hospitalization and death, and in many people prevent infection of any type. And that is a worthy goal, and to get a disease under control to the extent that most of us who choose to get vaccinated are protected from a serious illness, I think is a reasonable and realistic expectation. Whether or not we can ever get to this so-called herd immunity threshold, where basically the disease no longer spreads in our society, I think is less clear for a number of reasons. One is because there is a limit to how many people will be vaccinated. And with some of these new variants, the estimates for herd immunity, people being immune, in other words, are very high, it's 80% or so. And so it's not clear that we'll ever have, 80% of the population vaccinated with, current protection at any one time. And that may be because some people choose not to get vaccinated, or because we find out that people will be protected for some number of years and then require revaccination. And that further complicates, maintaining herd immunity at a very high level. We don't have a vaccine for children yet, and whether we could achieve herd immunity without vaccinating children, I think, is questionable as well. So I don't really think that the goal of herd immunity is something we should necessarily be our metric for success. It would be wonderful, but I don't think I don't think it's something that is necessary for us to get COVID-19 under meaningful control. And by that, I mean, we can make this a manageable infection without achieving herd immunity. And I think that's probably a more realistic and appropriate goal.
Next question is from Carolyn Bick.
Hi there. Yes, sorry about that. It took me a hot second to unmute my microphone. I wanted to ask actually a couple of questions, so I'm happy to rephrase the second one after the first. But I did want to ask, is the drop in cases coming in part from decreased testing due to everybody's basically exuberance over the vaccine? And then two, with many teachers here being forced to go back into the classroom on March 1st, are you worried about the lack of data specifically regarding the disease and death rates among teachers from and serving Black and Latinx communities?
Sorry, could you repeat the second question?
I'm so sorry. Yeah, with many teachers here being forced to go back into the classroom, I think it's on March 1st. Are you worried about the lack of data specifically regarding the disease and death rate among teachers from and serving Black and Latinx communities?
You keep fading out in that last clause, the disease and death rate among teachers serving Black and Latinx communities?
Yes, sorry, I don't mean to.
Okay, yeah, sure. So yeah, with respect to teachers going back into the classroom, I think there's a lot of data that suggests that when appropriate precautions are taken, the risk can be greatly reduced. And the risk is dependent on a couple of things. It depends on the overall level of transmission in the community, and it depends on the ability of the school to implement these prevention steps. And so the information that's available from Europe and from the US, and I think the CDC came out with some new data summary today and guidelines that I haven't had a chance to review yet, but the information that they've been sharing recently suggests that in those communities that have gone back to school, the COVID transmission rates have been comparable to or less than the surrounding communities, so that the conclusion is, school can be done in a relatively safe way with precautions. Now, when there's COVID in the community, there will be COVID in the schools. We shouldn't be having any illusions about that. There's no such thing as a 100% safe level when we have high levels of COVID in this country. There will be children and teachers who develop COVID, just as we have occurring in every aspect of our community, in all of our occupations and all of our essential workers. People have taken risks, gone to work and been exposed to COVID in order to continue to provide to us as a society essential services. And so there is a level of risk that is inherent in having a global pandemic that has not yet been controlled. And what our goal is to try and decrease the risk to the greatest extent possible, understanding you really can't eliminate it. With respect to having specific data on teachers who serve Black and Hispanic communities, I have not seen any data stratified by race, ethnicity, or social vulnerability index, for example. I'd be interested to see that, but I think that the bottom line is that it's the most important factor is whether the school can take the precautions necessary around cohorting kids into small groups, hybrid learning model if possible, mask use, and enforcing the adherence to mask use. Very important around ventilation. There's lots of good information now also recently updated, but from CDC and others about the importance of ventilation and strategies to improve ventilation in the school setting, and other strategies to keep students separated from one another to the greatest extent possible, screening, and so on. So I would feel that if those measures were put in place adequately, regardless of the race of the teachers or the students, we should see comparable levels of protection. Where we might see variability, however, is certain communities have higher incidence rates of COVID to start with. And so the challenge for those communities is going to be greater, just like the point that I've been trying to convey for all of us is with the new variant, the challenge around COVID is going to be greater. So that applies across the board to everyone because it's a more transmissible virus. It infects people more readily, and it may cause more serious disease in adults. We're not sure yet. So I look forward to seeing additional data if and when they become available by community and by race and ethnicity, if that appears to be relevant. But at this point, there's just not any evidence one way or the other to make a different recommendation based on the race or ethnicity of the teacher or the community. With respect to your first question, I don't think that the drop in cases is related strictly to or to any great degree to fewer people getting tested, because our proportion of positives has not gone up. You would expect that the proportion of positive test results would go up if only those people who had more severe symptoms were getting tested and many were being unrecognized. I think that there are still too many people who aren't getting tested who have symptoms, and that leads to transmission. That's preventable, and that's why I encourage everyone who's been around someone who has COVID to be tested or has symptoms compatible with COVID to be tested. But I don't think that's what's driving our current drop. This drop is being seen across the country, which is very interesting. We've had 3 waves now nationally, and we're not completely synchronized, but we're fairly close. And it's probably a combination of I think it's primarily driven by people's behaviors and the steps that they're taking once they see disease rates in their community get to a certain level. People get more serious about taking COVID prevention steps, and then the rates come down. And this is what I'm very worried about, that people don't get complacent now and feel that because our rates are dropping, we're in a good position, because our rates are still high and because we're going to be challenged by a much more contagious virus very shortly. And so lack of testing is not the driver here, but more testing would nonetheless still be beneficial.
Thank you. And on the note of testing, we just got notice that a number of our King County COVID testing locations will be closing this weekend due to the weather. So we're going to be sharing more information about that on our King County webpage this afternoon. That's kingcounty.gov/COVID/sites. Again, that's our testing locations. The Kent vaccination site at this point will remain open this weekend. And we're going to open it for one final question from Eilish O'Neill.
Hi, thanks for taking our questions. I have 2 questions. The first is, do you think it's safe to reopen restaurants, et cetera, with the new variant here? And the second is, are measures in place to make sure that if people can't make it to their vaccination appointments this weekend, no vaccines will be spoiled?
Mm-hmm. Yeah, thank you, Aisha, for those questions. I'll start with the second one. Yes, we are thinking hard about all possible contingencies around vaccine safety and storage and handling. And just had a discussion about this with the team this morning. So, doses will be kept under refrigeration or in the freezer and brought out as necessary. If doses are at a site and people don't show up, we're going to make sure we have the equipment in place to get those doses back to the appropriate storage facilities as quickly as possible. That's, hopefully that will avoid any unanticipated spoilage of vaccine. We really don't want that to happen, and we're going to be cautious about, only bringing out of storage the number of doses that seem necessary for the people who are appearing and presenting for vaccination. That's a great question. Something we focused on this morning. With respect to, is it safe to be reopening restaurants? I mean, safe is a relative term. It can be, in general, I've been advising people to limit their activities, limit their indoor airspace exposures to others from people outside the home, wear masks all the time. We know that indoors is a higher risk transmission venue than outdoors. We know that venues where people don't wear masks are a higher risk transmission venue than people who, or than venues where people can wear masks. So restaurants and any other facility where people come together indoors, and particularly if they're not wearing masks or spend a long time, do pose an increasing risk, and people need to take special precautions to reduce those risks. So I'm hoping that if people do choose to take that risk, that they are very careful about the ventilation and measures that are being taken in that restaurant or any other facility to improve ventilation. But there's levels of risk, and there's nothing that's completely safe. I'm nervous about it. I think that's been clear on our last several calls, and I'm still nervous about increasing levels of activity, particularly indoor activity, given the fact that our rates are still relatively high, and that we do have these more contagious variants on the horizon. So I urge people to use caution in deciding how they spend their time, where they spend their time, and how long they spend in indoor air spaces. I'd be very, very happy to be wrong and not have all this worry to be for naught. But based on the experience in Europe, based on recent data from the United States, the B.1.1.7 variant is doubling every 10 days. It has caused a much larger wave in Europe than the previous viral waves. And I don't see why we would expect anything differently here. So given the fact that, the governor has authorized, certain degree of indoor activity, I just think we need to do this as carefully as possible, continue to be very vigilant, and take all steps to reduce the risk in everything we do, particularly indoors. Minimize time we spend around others without masks on, minimize time in crowded spaces, especially indoor spaces with poor ventilation, and be very vigilant to understand if we see things moving in the wrong direction, we need to consider changing our policies around what activities make sense.
Thanks, Dr. Duchin. Any final remarks?
I don't think so. Again, just a reminder that it's great that our numbers are going down, but we're not at a level where we can relax. We have a great challenge ahead of us as we emerge from the eye of the hurricane. The other side of the storm is inevitable, and the extent to which we're able to manage it, reduce number of hospitalizations, cases, and deaths will depend on what we do as a community and as individuals. And that involves reducing our activities, masking, limiting indoor activities, limiting the time we spend with others indoors from outside our household, and so on. So the same COVID prevention measures, but we're really going to have to continue to use them. And we shouldn't see this lull in activity as the end of the story. We're not out of the woods yet. We've got a lot more COVID-19 ahead of us before enough are vaccinated that we can think about relaxing for the long term.
Great. Thank you. And thanks to everyone who joined us. As a reminder, you can follow us on social media at KC Pub Health and on our blog at publichealthinsider.com. Thanks so much.